Hi ladies, and welcome to this week's episode on my new YouTube channel. I am so excited today because I talk to you all the time about hormone pellets, but today you're actually going to see me place a hormone pellet live on one of my very special friends. So as you recall, hormone pellets can be either bioidentical estradiol or testosterone or both, depending on what you need, depending on where you are in the menopause spectrum. So today I'm going to show you how easy that is. So some of the myths about pellets are that it's really painful to have them placed or that it's a really gruesome operation. And I'm going to show you just how easy it is. It literally takes just a couple of minutes. And you'll see when the patient has it done, it really doesn't even hurt. You can exercise the same day, you can shower, you can pretty much go back to normal activities. And the pellets last for an average of 3.5 months. So the really nice thing about it is you're getting hormones in a really stable, even level without having to do anything. Now, some of you might have tried other types of hormone replacement, which are really good if that works for you. You can use bioidentical estradiol and testosterone in a cream form, even in a sublingual tablet or drop that you put underneath your tongue. And I tried those. Honestly, doing something twice a day where you have to measure it, I couldn't do it. There's so much human error. I would go to work and I'd left it at home, or one time I went overseas and I left it at home and my levels crashed. So the really nice thing about pellets is they're in your bottom. You can't leave them at home. Now when I travel, just go straight through the TSA check. You don't have to worry about leaving them anywhere. It just makes life that little bit easier. And I think when we're perimenopausal and menopausal, life can be difficult enough. So this is just another way to make your life a little bit easier. So I can't wait to show you real live what it's like to have a pellet placed. I've got my pellets ready for my friend. She's going to get here any minute. Let me show you what they look like. Another myth is that they're these gigantic things. I'm not sure if the camera can see in there or not, but they're really quite tiny. The testosterone pellets I always compare to a piece of long grain rice. Estradiol pellets are more like a little piece of couscous, which is interesting because estradiol is actually a lot more potent than testosterone. Probably explains why women are stronger than men, right? But the estradiol starts working in 2 to 3 days, whereas the testosterone can take a week or two to get into your system. It's not quite as strong of a hormone. Another myth is that testosterone is a male hormone and estradiol is a female hormone. But men have both. Women have both. We just have them in different levels. So I take testosterone. You can see I don't have a beard, I don't have acne, I don't have oily skin, I don't have gigantic muscles, but what I do have is some nice moisture in my skin. I've got some muscle tone back again. I've got great sex drive. I've got energy. So this is what hormone replacement can do for you. And I'm going to show you how it works in just a moment. So just before we place this pellet, why do some people get testosterone only? Really quickly, when you get testosterone, you also do get some estrogen because there's a process called aromatization, which just means some of the testosterone converts into estrogen. And for a lot of women, that's enough. So some people are really sensitive to estrogen, like myself and Dominique. I can get breast tenderness and other symptoms, so I prefer just to get the testosterone. Or if we do get into some trouble with our estrogen being a little low, we can always use an estrogen patch or something different. So there's a lot of different options. You can get both estrogen and testosterone in the pellet, or you can just get the testosterone only. So we're about to do it. Let's have her come on in.
So I'm ready. I've got my dress on and Susan has me draped and she's got the spot ready to go. And we've got 2 cameras so you can see my perspective as well as what she's doing. Ready?
All right, yay.
Okay.
So this is the setup for pellet placement. Kind of looks like we're doing a big operation, but really we're not. It's just making sure we keep everything clean. So I've got my gloves, my sterile cleansing things, tiny little poke with a scalpel, and I'm going to show you how it all works. This is where I need to put on my reading glasses because you know I'm 54 and I want to be able to see what I'm doing.
Please see.
So you know, Dominique had mentioned she's had this done before. We've actually had fun. We've done this at her house, and that is something that I do. I do it at home for people who like to do that. So it's I don't know if you can even see. But the previous mark where the pellet was placed is practically invisible. I mean, I have to really look closely to even see it. It just looks like a teensy little mark because it's literally only 2 millimeters in size. It's very, very tiny. But I'm going to go right through that same mark because I always hate to put more than one mark on anybody's skin. Now, if you were somebody who ultimately were going to get pellets over and over, we would go, one side and then the other side and back and forth. But you don't need more than 2 incisions because we don't want to create little polka dot situation. Now, anyone who's got Botox knows what a Botox needle is. This is a 30 gauge needle. It's a teeny, teeny, tiny needle. But lidocaine, which is what's in this little vial, does sting a little bit for all of us who've been to the dentist. So the only part about this that hurts is that it stings for about 5 seconds. So Dominique, here's the little sting, little ouchie, 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 and then we just talk about the weather and count to 5, 1, 2, 3, 4, 5, and then it's not going to hurt anymore.
That's nothing.
Yeah. So what do you think? It's not even like a bee sting, right?
Yeah,
it's just,
not even.
And it's a teeny, teeny needle.
Right, and then it immediately goes away.
Now, normally the patient can't see this part, but I'm going to put a little bit more local anesthetic into the channel where the pellet goes, which is actually about 2 inches away from where the tiny little incision is going to go. This is a tiny bit bigger needle, but she's not going to feel it because it's already numb right here. So I'm going to go right through that numb spot and then just numb that. Dominique doesn't really have much fat, but the little bit that she has, we're numbing just to make sure she doesn't feel anything. And that's the extent of everything that hurts. So how is that?
Piece of cake?
Yeah.
Honestly.
So now it won't hurt anymore. So, some people don't like watching any type of procedures. So this, you can see it's not bleeding at all. It's a tiny little scalpel. I'm literally going to make a little 2 millimeter poke in the skin. It's just teeny, teeny, tiny. And again, I'm going right through that old scar. I don't know if you can see that with the camera, but look how small that is. It's if you had a freckle removed at the dermatologist, it would be bigger.
Really?
Than this. Yeah, it's teeny, 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 teeny. Now, Dominique, when you can eventually watch this video, you'll be able to see this.
I know, I've never seen that perspective before. I'm so curious.
Patients have never seen their own pellet being placed. When I talk to patients, I tell them this is a hollow needle. Now, actually, in medical terms, we call it a trocar because it does look a little bit scary, but it's actually it stretches through the skin. So you might feel some pressure. I'm just burrowing it through that tiny little incision. It just burrows underneath the fat, and you can't feel that at all, right?
Not at all.
You might see it has a little channel right there. That little channel is where the pellets are going to go. So we calculated Dominique's dose exactly for her. And this is actually a dose that we've used before, so we know that it works. You can see I'm actually placing 2 pellets because they're kind of like Lego blocks. They come in all different doses, and you can add them together to come up with the perfect dose for the patient. So in her case, it's 125, which is 2 different little pellets. Push them in, and that's it. So that's done. Now this tiny little mark, we want that to be invisible, so you can see it's really not bleeding at all. But I'm going to use a little bit of this is our magic sticky glue. Put a little bit on each side. And then most of you know what steri strips are. You might have used them if you have kids, if they have a little cut on their face or what have you. So we just put a little steri strip over it. Now, because of that sticky glue, that's going to stay on there for about 3 days, even with showering. That's all we need to do. Honestly, if I didn't cover it at all, it would be just fine. But, we try to be perfect. Now, just so she can shower and exercise, I'm going to put a clear cover over everything, just so that we don't get any blood on her pretty dress. This is a little bit unnecessary, but I like to do it anyway. This is an occlusive cover. It's just like sticky saran wrap. And that's it. So I keep this cover on for 48 hours. That way you can shower. I've actually even swum with mine on. You're not supposed to do that really, but it does stay on even when it gets wet. There are some rumors. In fact, some providers say that you shouldn't exercise for a day or 2. You can exercise. It's not in the muscle. You can go to the gym today. You can do normal activities. That's it. So in 2 days, she's going to take all of that off. And there you have it. That's what a pellet placement's like.
Piece of cake.
How was it?
Nothing.
Yeah, and I could have done it twice as fast if I wasn't talking through it. I wanted to mention something that I forgot to say, which is in the past few years, we have found through lots of studies that testosterone actually decreases breast cancer risk. So add that to all the other benefits. Osteoporosis prevention, it's great for heart health, it lowers cholesterol, decreases breast cancer risk, libido, energy, muscle conservation, tons of benefits. So I'm all for it, and doesn't hurt.
At all. And I'll be back to see you in 3.5 months.
Yay, awesome.
Thank you.
My pleasure.